Hi. Now that you've had a couple of minutes just to kind of look over the estimate, I just wanted to check in and see if you had any questions. You do? Okay. Is there anything specific or is it more just general questions? Yes, absolutely. I can totally go through line by line with you and just kind of explain what things are. I actually printed out my own little sheet of the estimate. I know that you have your copy, but this way we can kind of look at them and I'll go through line by line with you and just explain what things are, answer any questions that you have along the way, okay? Awesome. All right. So just looking right at the top, that range of number, that's just the overall dental estimate. We like to give you guys a low end and then a high end. It'll probably end up falling somewhere in between. Most of the time that's what happens, but we like to just bump it up to the higher end too, just in case. It'll depend on things like how many images we take for radiology, and if we need to extract any teeth, and if we do, how many teeth we need to extract, all that sort of stuff. But we'll get there in a little bit. The first line is the office visit. That's just our set price, the $54.95. That's just for you coming in, having his general look over, all that sort of stuff. That's just our baseline office visit. When we move down, that first big section under the dental prophylaxis canine package for $335.95, that's our base. That's another baseline number. This is our general canine dental package. So looking in there with everything, all of the stuff in there doesn't have its own kind of set price just because it is a package. So it's just everything that we normally do for a dental visit included in that package. So we have the hospitalization, so him being under the doctor's supervision, and then our hospital care team looking after him. We also have his pre-anesthetic examination, so that's when us techs and the doctor take a look at him before we kind of do anything with him, just to make sure that he's looking okay. Heart, lungs sound good, just generally. We also do collect a blood sample beforehand, and that's when we'll run a CBC or a complete blood cell count. That's when we're looking at his red blood cells, white blood cells, making sure that there's nothing that's elevated that shouldn't be. Like if we saw an elevated white blood cell count, that could indicate that he has some sort of underlying infection. And depending if that happened, we might want to treat that before we go through the dental, or it could be fine. We also look at his electrolytes, making sure that like his vitamin K, sodium, potassium, that's what vitamin K is, sorry, everything's in balance. We don't want any electrolyte imbalances. That's when things in the body get wonky. And then we also do what's called an IOF, or an internal organ function. That's when we check to make sure his kidneys are working good, his liver's working good, because those are the body systems that will be kind of working through all of the medications that we'll be having to give him, and we want to make sure that those are able to work properly, so that way there's nothing being left in his system that doesn't need to be in there. Next in this package is the pre-anesthetic sedation. So typically for dogs, especially an older guy like Skipper, we like to do a combination of buprenorphine and butorphanol. Those are just two sedative drugs. So this will get him nice and relaxed before we do anything further with him. It usually goes intramuscular, so it's a super tiny injection usually right into the muscle. It takes a couple minutes to kick in, but that'll get him nice and relaxed. Once he's relaxed, we do IV catheter insertion. That way we can give him fluids during the dental, and we can also do either emergency drugs, or we also give like post-operative pain control right before we wake him up, IV as well. Like I said, we'll give him fluids, so there's also the IV extension, IV fluid set that goes onto that. And once we get his catheter in, we do give him a pre-medication or induction injection. So we use propofol for that. And that's what really gets him really, really relaxed, and that's when we will be able to intubate him, because with the general sedation that I was talking about before, he's still very aware with that, and we wouldn't want to intubate him at that point because it just wouldn't be comfortable for him. We want to make sure that we give him the propofol so then we can intubate him. Following the intubation, in this package, we also have the anesthesia for the canine dental. So that is the sevoflurane inhalant anesthetic. That's what we will that's the gas that we will be giving him to keep him under anesthesia. There's the anesthetic monitoring. So that's when we hook him up for blood pressure, ECG. So watching his heart rate, making sure that it's beating correctly, all that sort of stuff, and pulse oximetry. Which is when we're making sure that he's staying nice and oxygenated. We have the fluid that we'll be giving him so that way he stays nice and hydrated. That's lactated ringers. And then just the dental prophylaxis. So that's when we're actually doing our dental charting. That's when we are going in with our ultrasonic scaler and cleaning off all of that calculus, any plaque, and then we go in and we do the polishing just like a human dental, to make sure that everything's nice and smooth, nice and clean, looking really nice. After that, we just have the post-op pain control injection. So we give an injection of Rimadyl, and that will go subcutaneously, so under his skin, and we do that during the procedure, so that way it gives him some post-op pain by the time he's waking up. And then we just have recovery care after anesthesia. So that's us monitoring, making sure he's waking up okay, making sure he's not in an excess amount of pain, all that sort of stuff. So next, moving down the line after that giant package section, we do have the dental radiography with anesthesia. So we do take the x-rays of his teeth while he is under anesthesia, just because we don't want him waking up, biting down on our sensor, because it's super expensive, and it's just a lot easier for us to move things around and get all the pictures that we need. And that is for $199.05. That is for a full mouth set of dental rads. I put that on there. That's the higher number, just because we won't really know how many radiographs we're going to need to take until we're actually in there looking at his teeth, seeing if there's any like gingivitis, or if there's a lot of dental calculus, or if there's any signs of periodontal disease. Because he's an older guy, there's a good chance that there will be some amount of periodontal disease, but we won't know until we actually get in there. So I did put the full mouth set of rads just in case. And then if we flip it over to the back, this is the section where it can get really variable in the price depending on what happens. So here I've listed things for if we do have to do extractions. So if we get in there, we're looking at everything, the doctor comes, she'll take a look at his mouth, see if she thinks there's anything that needs to come out, whether it's because something is fractured or if there's root disease, all that sort of stuff. That's when the extractions will come into play. So with extractions, we would need an additional surgical instrument pack. That's the 1782. I did put the general anesthesia additional 15 minutes. So after 45 minutes of the normal dental procedure, if things are taking longer because of extractions, there is an additional $51.90 charge per 15 minutes of extra anesthesia. Following that, we have a suture and needle, because if we're extracting things, there may be larger pockets that need to be closed, so that way food isn't getting stuck in them and causing more issues, all that sort of stuff. And I did put a dental nerve block. That's the bupivacaine. We're gonna skip that. Okay. So after that, I did put in the dental nerve block, and that'll be per milliliter. We'll see. It depends on how many extractions he'll need, so that is a variable price. And then we get to the actual extractions themselves. So depending on what kind of tooth we're extracting, that'll vary on the price. So for instance, if we had to extract an incisor, the extraction of one incisor tooth, which is the tiny little front ones, that is $43.98 per tooth. If we had to extract a carnasial tooth, which is his big canine tooth, it is $189.28 per tooth. Just because it is a very large tooth, it can leave a very large pocket, and we want to make sure that everything gets out of there. There's nothing left in that can cause further issues down the line. Premolar extraction is $63.08 a tooth, and molar extraction is $82.76 per tooth. The reason that it varies per tooth is one, based on the size of the tooth, and then also the root structure of the tooth. So the very last premolar in his mouth and the first two molars, they actually have 3 roots rather than 2 or 1 root. Like his tiny front teeth and his big canine tooth, they only have 1 root. So extracting those is a lot easier than extracting the 3-rooted tooth, because there's a lot more that we have to make sure we get out all the way. It's just a lot more to kind of work around. So that's why those might be a little more expensive. And then finally, we get to the post-op pain meds and antibiotics. Again, these might vary. They don't typically tend to be super expensive, but we do give you post-op antibiotics and post-op pain meds, which would be an anti-inflammatory. So I did put clindamycin on here and metronidazole, which are 2 antibiotics. She might prescribe one or the other, or it could be a combination of the 2. And the price quotes for those, for the clindamycin, it was like 20 tablets, capsules, and it was going to be $60-$80. Again, that can be on the higher side depending on what we do. The metronidazole was for 3 tablets, which is $15.02, and then the Rimadyl, which I said is the anti-inflammatory, the pain med, quantity of 3 tablets. It's usually 1 per day. That's $10.22. So that's everything just for his dental estimate. Do you have any other questions? Anything you wanted to go back over at all? No? That's good. I'm glad that I could help you understand that a little better. I know that it can be very confusing, especially if it's the first time he's getting a dental. But I'm sure he's going to be much happier and healthier once he has this, and there won't be any more of that bad breath, the halitosis. So we'll get it all taken care of for you. I do see that you are already scheduled for your next appointment. It's for him to come in and get that dental. So we look forward to seeing you then.